I think it was a very balanced exam. The part one of the paper, in my opinion, was slightly more trickier than the parts two. But in when I say trickier, I mean that from a few subjects like etc., we didn't get the questions that we expected. Like a lot of image-based questions or anything were not there.
Hi guys, this is Dr. Pritesh Singh, Prep Ladder Surgery faculty, and with me is Dr. Sneha Dutta, who secured 228 marks in FMGE December 2021. So congratulations, Sneha, for your wonderful performance.
Thank you, sir. Thank you very much.
Introduce yourself and tell the students something about yourself, your preparation strategies.
Thank you, sir. So, hi everyone. This is Dr. Sneha Dutta, and I am graduate from Volgograd State Medical University, Russia. And in the recent FMGE December 2021 exams, I have secured 228 marks and I cleared the exam, my first attempt.
Okay, so how will you rate this exam, December 2021 FMGE exam?
I think it was a very balanced exam. The part one of the paper, in my opinion, was slightly more trickier than the parts two. But in when I say trickier, I mean that from a few subjects like etc., we didn't get the questions that we expected. Like a lot of image-based questions or anything were not there. But every question that was there was more or less covered in the app. That is for sure. And if anybody has the app thoroughly, I think they would have easily solved those questions as well. And the second part of the paper, I think, was pretty easy, very standard question paper, how you would expect it to be, like how we had expected it to be. There were a lot of clinical questions and there were a lot of integrated questions. So somebody who has done all the 19 subjects well will definitely be able to score really high in, because a lot of integrated questions are there. It was hard to distinguish that every question from which exact subject it was. So it was a very balanced paper. I think it was a good paper.
Okay. And how many questions you attempted in this exam?
Because there's no negative marking, so I attempted every question.
Right. And what was the subject weightage? Means maximum questions were particularly from which subjects?
I think in part one, there were a lot of questions from PSM as expected. There were a good number of questions from microbiology also, but they were very integrated, little clinically put. There were aspects of microbiology in the question, and also there was microbiology plus clinical features of the condition, or there was an image maybe.
Right.
So that was there. There were questions from FSM also. Forensic medicine also had a good number of questions. Okay. Biochemistry had really good questions this time. They were actually not very direct questions. To solve those questions, you should know your concepts and you would have to think.
Okay.
So I think that anatomy questions were pretty simple, what you would expect. Anatomy was pretty good. Anatomy also was. So I think there was questions from every subject. There were questions from physiology. There was questions from every, because I think last time there were very few questions from physiology. Right. That was not the case this time. So I wouldn't suggest anybody to even leave physiology, because sometimes नई question तो अभी नहीं आ रहा है उसमें. Some questions were integrated, but for some questions you would require physiology knowledge itself. So right. I think there were a lot of integrated questions, clinical questions, and all subjects had questions. Maximum weightage, of course, was PSM, I would think, first paper.
Okay, and second paper?
Second paper, lots of questions from surgery, lots of questions from medicine. I think medicine and surgery were dominating. Ortho had fair decent number of questions. I think maybe 10, 12 questions. Because a few were spot diagnosis. So like I said, I cannot tell you that this is this subject. It is
right
everywhere. So kahin se bhi padh lo, you'll be able to get that right. Oh yeah, ENT and ophthalmology. I think these two subjects really boosted my score. Because everybody studies medicine, everybody studies surgery. I think nobody has... Obs and gynae, of course, lots of questions from obs and gynae. So obs and gynae, obs and gynae and medicine. Everybody studies, nobody reads. But I would really suggest don't leave ENT and ophtha. These are the subjects which have boosted my marks, because there will be around 12, 15 questions each from these subjects, and this can really make all the difference. So yeah, ENT and ophtha also, and all the minor subjects also were there. Pediatrics, I think there was a lot of integration with pediatrics even in the first paper.
Right.
From the IMNCI guidelines, the color thing, I think I could spot 2 or 3 questions from both papers combined only on the IMNCI guidelines.
Okay.
What will patient, or what should you do to the patient, or the diagnosis. I don't remember exactly, but there were a lot of questions from that part.
Okay. And when did you actually started with your preparation?
I started my preparation in the early months of 2020.
Okay, 2020.
Around January or February 2020, yeah, early months. And initially, it was a slow start. Okay. So I took a lot of time to finish just obstetrics. Then I took a lot of time to do just the cardiology part of medicine. And then a bell rang in me that I can't be this slow. And I started finishing subjects quickly after that. The preparation started from there. But since we had college and everything. So it was, when you are in a different country, you have to also fend for yourself. You have to cook, clean. All these things are on you. You don't have someone to do it for you. So all of these things to be done, they required. And at the same time, you have to also prepare for the curriculum of the next day of your actual university classes. That also is there. So overall, I think I could only give 3 hours my day to my preparation. Three maximum if I stretch it, or if it was a holiday or during the pandemic time when classes were online, it would become 4.5 hours. That was the maximum. So this is when I did all the videos on the main part of the app.
Okay.
And after that, after graduating, and I finished all the major subjects from the main part of the app, English section, I finished that.
Okay.
And after that, after coming to Delhi, I went to Delhi after my graduation to prepare to Gautam Nagar, like many students do. And over there, I started revising, and revision was from rapid revision. And for rapid revision, I also made my own notes, personal notes.
This kind of feedback was there from the students who, secured good marks. They were telling us that some subjects which they were not able to complete, they were doing it from rapid revision only. And they really, got, I think most of them got 200 plus just from the rapid revision because they were not having enough time. So you are also suggesting the students should do at least rapid revision if they are not doing it from the main videos, and they should not leave even a single subject. This is your main advice to the students.
Yes, sir. This is my main advice to the students. Don't leave any subject, because like I said, for many questions, I was not able to judge what the subject was.
Right.
I just knew this is the answer. There was some hint in the question. Same question, there's a pathology aspect to it, there's a medicine aspect to it, age of the child is mentioned. If it's a child, there's a pediatrics aspect to it. So you have to, and or they ask you, they give you everything, and finally they ask you a drug. So you get the diagnosis correct because you know the pathology or the medicine, but you get the answer correct finally because you know the pharmacology correct. So very important to do everything. Rapid revision has been my best friend in the past 6 months. I think that has really boosted my score. Also, like I would like to add this point that when you're doing the rapid revision, it is best to make your own notes from rapid revision, because it is not such a vast content. Sometimes when you do the full videos, it is either you don't have the time, or it might get a little boring to write everything. But rapid revision so chota hai na content, that definitely you can make your own notes. And like I would like to say this, which what I did. If you're studying, if you have the ability, like if you have the means, and if you're studying on an iPad or a tablet, just get maybe the Apple Pencil or get any ordinary stylus pencil and make these notes on the iPad, because nowadays the pattern is such that a lot of image based questions also come. So when you write it on pen and paper, it is not possible for you to add the pictures. So just write on your iPad simultaneously, topic ke hisab se, just add the pictures. So you have the whole thing that you need to study in one place, and you don't have to actually see snapshots or anything baad mein again for the images alone. So it's your own handwritten notes. So good memory from that. You have the pictures along with this. So photo memory also happens, and it's just, I think it's the best way, and that's what helped me. And one more thing, please have a study partner when you're studying. Really, really, really helps. Because my study partner was, I can mention, it was Dr. Gaurav Chapekar, who also used Stepladder as primary source for studying. And it is to say, I'm very proud to say that he also cleared his FMGE time with 193 marks.
That's really,
so
really great.
We started preparing just from Volgograd itself, from before graduation. From when I started preparing with him. So having a study partner really gave me that, that motivation, that extra push. So we gave each other targets. And if one person completed the target, the other person had to complete the target. So if someone feels a little lazy on some day, or just is not in the mood to study, so there's somebody to push you, somebody to motivate you, somebody to share your knowledge with, and somebody to, after watching a video, you video call kar liya, and then you're discussing ki aaj sir ne ye bola, this is the meaning of this. Or if you're doing the same videos together, for example, if you don't understand a thing and the other person has understood, so explain kar liya. It is really, really helpful. Please, if possible, have a study partner, motivate each other, have a healthy competition, and I think both of you will pass then.
And what was your frequency of solving mock tests?
Mock tests, I have given, overall, I have given 4 mock tests, because when I was before graduating, I had not given even 1 mock test. After coming to Delhi, when I started the full-fledged preparation, in a span of from July to December, I have given 4 mock tests overall. The first mock test I've given after my first revision, like when I finished rapid revision and when I finished making my own notes for the first time.
Right.
After that, I gave one mock test, and in that mock test, I secured one mark. It was applied a mock test only,
Right.
like the mock tests which were available. And after my second revision, I another mock test, and in that I scored 191 marks.
Oh.
So I think maybe I became confident, or I don't know what happened to me. And when I gave the third mock test after my third revision, my marks decreased again. I got only 165 marks, and that was really important. I think if I would have got higher marks in the third mock test, I would not have, given that extra push to myself to work harder.
Right.
In the last month, which is the most important, I think last month is most crucial because you remember maximum things from what you have studied in the last month.
Right.
And what you can remember is what you can produce, and what you can produce will decide your marks finally. So I think, yeah, that really helped me. And in the fourth mock test, my final mock test, which I gave on the 5th of December, in that scored 224 marks, which is really close to what I actually scored in the exam.
224, and here in December exam you got
228.
So almost,
yes,
the same marks.
Very similar.
Right. Similar.
Almost similar.
Right.
Yeah.
So who are your favorite teachers in the dream team?
I cannot name any one teacher who is my favorite because all the education I've gained and everything I have done it from Prep Ladder, and so it is hard for me to name one teacher, but I name 5-6 teachers who are my absolute favorite, from whom I gained motivation also, and whose videos I really wanted to watch also. So that one is definitely you, sir.
Thank you very much.
And Dr. Marva, because from his videos, what I really liked was in the end of every video, there was one motivational talk. 2 minutes or 3 minutes, he always motivates. So once you finish that video, wo motivation sunne ke baad, automatically you want to start a next video. You don't want to waste your time after that because he has just motivated you. So that helped. Dr. Garg, definitely, because his mnemonics are the best, I think. It really helps to remember drugs. For example, from my experience, I can say that there was this question about post-chemotherapy induced vomiting, what will be that? So, however he taught, I didn't know the actual prefix in the exam, but I knew it is a cetron drug. I had learned granny cetron, on-time cetron, and there was a cetron drug. I don't remember the prefix even now, but I could mark the answer. And his mnemonics really helped. So Garg sir definitely, Sparsh sir definitely. I don't think I can ever have a better teach me pathology. I really understood what he said. Everything made sense. And after doing pathology, when I did medicine and surgery, all the more everything made sense. Dr. Apoorv sir, because if somebody has watched or is planning to watch his full videos, in every video, beach mein, he says some stories from his own experience. So one thing is your link doesn't break, like you don't get bored. And secondly, you learn something from his experience. And thirdly, you feel like there's some interaction between you and the teacher.
Right.
So I think that will really keep you hooked up. Otherwise, Dr. Manish Soni sir, Magendran sir, everybody has played their own really beautiful part in my journey and helping me understand. Dr. Sonu Panwar sir, actually, I had this opportunity to meet him in person also once. Just opposite the Prep Ladder office in Gautam Nagar. I think there's a very famous fast food stall, I'd say, chaat stall. There is there. So I just gone there and I saw sir, and it was like I was meeting a celebrity because I have seen y'all on the app. So actually to see face to face, and then sir really spoke to us that day and he motivated there. Sonu Banwar sir, everybody. I can just say thank you. I can't to express my gratitude.
Right. And what is your favorite feature in the app?
I think my most favorite feature of the app is the fact that we can change the language, that we can change to English language, because when you listen to something in a more familiar language, not like English is not familiar. Most of us have studied in English medium schools and we are still continuing to do medicine in English language. But in English, what happens is sometimes it can become a little bit monotonous and a little bit boring. So you might lose your link and you might zone out. But in Hindi, in the English part of the app, it feels like the teacher is really in front of you and the teacher is interacting with you. So you don't lose that concentration in the English part of the app. I think that is one really nice feature of the app which I like. And the other feature is the statistics part. There's a section that the app tells you, okay, today you have achieved this much today, and there's a streak thing. If you do well continuously for 2-3 days, then there'll be a streak, and there's like these poppers come out, and there's like the streak. So I think it helps you track also your journey and track how well you're doing, because there should be a growth. Steady growth, slow growth, however, but there should be growth. No? It should not be like you're in the same place or you're going down. So it helps to track that also, your own progress. So I think it was really helpful to have that statistics part of the app. These would be my two most important features of the app.
And lastly, share your tips or advices for the students who are preparing for FMG.
Most important advice would be, don't think any subject is small so you can leave it. Because you don't know in the exam what one point from that subject will literally help you solve the question. Because for me, there were many questions where just the pathology part was to me, and I was like, okay, I know this, and I marked it because they'll give you clinic. A lot of questions are integrated. They'll give you clinical features with one pathology aspect added to it. Maybe they'll give you something from pharmacology, something, or like microbiology with dermatology, a lot of integration in that, and also pediatrics and microbiology, pediatrics and medicine, internal medicine, pediatrics and surgery, a lot of integration. Radiology, please don't leave radiology. Seen radiology from Khalil sir also. I have seen radiology from Zanab ma'am also. When I was doing the whole videos, I saw it from Khalil sir, and when I did the rapid revision, I saw Zanab ma'am's rapid revision. Equally wonderful teachers, and both have played their own journey. So that is definitely there. And yeah, don't leave radiology because a lot of questions can be solved from radiology. If there is an image and if you're lucky enough, nothing in the question makes sense, you can just mark based on radiology. And please, I would say nobody should make a mistake with pneumoperitoneum. It is definitely going to come. It has come all the time. Just see that picture as many times as you can. It's a really simple picture. Because just don't miss it. Why to leave an easy point there? So radiology, do all the subjects. Don't leave any subject because it is a really, nowadays the paper is really integrated, and you should have good knowledge of all the subjects before to be able to solve maximum number of questions. And some questions will be from outside. You can't help it. Don't get nervous in the exam. Don't think about the questions you don't know. Just concentrate on what you know, and definitely you will be able to clear this exam. Definitely. And have a study partner. If possible, from rapid revision, make your own notes. In that also, I'll say, if it is possible, try to make it on an iPad and add the pictures then and there. So you don't have to waste extra time in revising the pictures. The whole revision, holistic revision happens at once. So I think a little bit of time can be saved. Solve lots of questions, lots and lots of questions. And immediately after you finish the topic or the subject, solve the question so you understand very well whether you yourself have understood the topic or not. If you haven't understood, go back to it. If you have understood, don't waste time. Revise it in your next revision. So just and solve questions from as many places as you can, as many questions as you can solve. Like for me, at least I used to solve a minimum of 200 questions daily in all of the 6 months. And in the end, it became more. Like I used to solve, sometimes I used to solve 300, 350 questions also daily. Because when you get bored of notes, it's a nice way to revise and don't feel like, okay, I'm wasting my time or anything. And it's a good way to revise also, I think, because below every question, in most places, there's also an explanation. So I think it's very comprehensive way to revise also. So solve a lot of questions. That would be my advice.
Okay, thanks, Sneha, for enlightening our students with your experience. Congratulations once again for your wonderful performance. Good luck.
Thank you, sir. Thank you very much.